In the past few days, there have been reports of new variants of the COVID-19 virus in South Africa and the United Kingdom. Viruses mutate over time. That's natural and expected. The UK has reported that this new variant transmits more easily, but there is no evidence so far that it's more likely to cause severe disease or mortality. WHO is working with scientists to understand how these generic changes affect how the virus behaves. The bottom line is that we need to suppress transmission of all SARS-CoV-2 viruses as quickly as we can. The more we allow it to spread, the more opportunity it has to change. Vaccines are offering hope for some, but I'm deeply concerned that vaccine nationalism will deprive the world's poorest and most vulnerable people of these life-saving tools. Now is the time for political commitment to be translated into action. Pledges and promises will not protect anyone unless they are realized. Last week, we announced that the COVAX facility, which is backed by 190 countries and economies, has secured access to nearly 2 billion doses of promising vaccine candidates. In the early 2021, $4.6 billion in additional funding will be needed to purchase COVID-19 vaccines for at least 20% of the population of all low and lower middle-income countries. This will ensure health workers and those at highest risk of severe disease are vaccinated, which is the fastest way to stabilize health systems and economies and stimulate a truly global recovery.
So regarding the mutation of the virus, which Dr. Tedros just mentioned, can you please elaborate what WHO knows so far, in which countries, apart from UK, and does the same variant has been identified, and also if there is a link between this variant and the variant identified in the South Africa? Thank you.
So thank you, Naoko, for the question. It's a very timely one today. Yes, so there has been a variant under investigation, as the UK is calling it, that has been reported from the UK. This variant is SARS-CoV-2 virus, and it has a number of mutations that was identified through genomic sequencing that is carried out across the country. The variant under investigation was reported to WHO on the 14th of December, following detailed analyses that the UK had done in the southeast of England, looking at their epidemiologic surveillance data and their laboratory data, noting an increase in transmission at the end of November, December, while interventions were in place. They did some phylogenetic analyses and they identified this variant. They're calling it the B117 lineage, which includes this mutation at the N501Y site. There's a lot of work that's ongoing in the United Kingdom, and we're very grateful for working across Public Health England, different academic institutions and modeling groups, different labs that are looking at three different things. They're looking at transmission in this variant, and if there's any differences in this virus's ability to transmit. They're looking at the disease that this variant causes and in terms of clinical presentation and severity, and they're looking at the body's antibody response following infection with this variant. What we understand so far from the data that's been reported by the UK is that they have reported an increase in transmission in this variant, but I want to put that into context because what they have told us is that they're looking at an increase in the reproduction number, which is the number of people that one infected individual transmits to another, of an increase of about 0.4. So it's an increase of moving from 1.1 to 1.5. So there is an increase in transmission that they're looking at. Now they're trying to determine how much of that is associated with the variant itself, as well as behavioral differences in individual that this variant has infected. So they're still working through that right now. In terms of disease, in terms of severity, the information that we have so far is that there isn't a change in the clinical presentation or severity from this variant. But again, the work is still underway that they're looking at a number of factors, including patients who are hospitalized with this variant as opposed to the wild type, the other viruses circulating. And the studies around the antibody response are currently underway. As we speak here today, the scientists in the lab are working on these types of studies and looking at the antibody response, and we expect results from those studies in the coming days and coming weeks. So we're really grateful for colleagues working with us directly. They have informed us with more detailed analysis through our virus evolution working group, which was established to specifically look at mutations and specifically look at what are the studies that are needed to understand what these mutations mean and any potential implications. And they have informed us through our modeling network, where they've looked at trends in surveillance activities and surveillance data. So the data is coming in real time, and the UK is making information available as quickly as possible. They're reporting it to us as well, and we will make updated information available as quickly as possible. The UK has informed us that they don't believe that there's an impact on the vaccine, so that's good news. But again, there's a lot of information coming out, and there's a lot of studies that are ongoing. So at the same time, there was another variant that was identified in South Africa, and it has one of the same mutations, this 501Y mutation, but it's a different variant. They've arisen at the same time, so it sounds like they're linked, but it's actually a separate variant. And South Africans are also working with us through our virus evolution working group, and they are presenting, they have presented to us some preliminary results from the studies that they are doing. They are currently growing the virus in South Africa so that more studies can be done, similar to the studies that I just mentioned about the UK. So it does sound confusing that they're the same virus, but these are actual different variants.